Well, ending the pandemic is one of many priorities for President Joe Biden, but he'll need some help from the Republican Party. In his first 2 full days in office, the president signed a series of executive orders. Many of them address the pandemic and its economic fallout. The White House is now urging Congress to pass a $1.9 trillion relief package. Republicans are unlikely to approve a bill with that hefty price tag.
Biden understands he has to reach across the aisle. He has to do things that are agreeable to some Republicans to advance his agenda.
The White House has not confirmed when the president will meet with congressional leaders. It's been 1 year now since the first COVID-19 death in the United States, and since then more than 410,000 Americans have lost their lives to the virus. As our Aixa Diaz reports, a new study is shedding light on which hospitalized patients face the greatest risk of mortality.
The University of Maryland School of Medicine found men who are hospitalized with COVID-19 are more likely to die from the virus than women. The study looked at nearly 67,000 COVID-19 patients in hospitals across the country. It found men had a 30% higher risk of dying compared to women. In general, older patients are more likely to die from the virus. But the study's senior author says young people between the ages of 20 and 39 who have hypertension or poorly managed diabetes had the highest risk of dying relative to other patients their same age who don't have those conditions.
If you have a 60-year-old with no hypertension and a 20-year-old with hypertension, the 60-year-old still is at much greater risk, and the emergency room physician should be more concerned about that person. But the flip side is when comparing two 20-year-olds, one who has a comorbid condition and one who doesn't, then it's really important.
The study did find fewer hospitalized patients are dying now than at the beginning of the pandemic, partly because doctors have more tools at their disposal now for treatment. In Washington, I'm Aixa Diaz.
Well, doctors say even though treatments have improved, the biggest challenge for healthcare workers now is the number of patients coming in and overwhelming hospitals. Right now, the Liberty Memorial has around 1,600 flags on display honoring members of the Kansas City community who have died from COVID-19. The display is open now to the public and runs through tomorrow. For comparison, a century ago, the 1918 pandemic killed more than 2,300 Kansas Cityans. According to the CDC, more than 290,000 vaccines have been administered in Missouri, and more than 68,000 people have gotten both doses so far. In Kansas, nearly 145,000 vaccines have been administered. Around 20,000 people have gotten both doses. KMBC 9 News is compiling answers to your questions about the vaccine on our website. We're also posting state and county-specific information on vaccines from local health officials. You can find all of that at kmbc.com/vaccine.